You practice in an urban area?
Yes, I'm out in Collierville. Now I've been in two different areas. I've been in a low socioeconomic status area, and I've been out in Collierville where we have kind of a mixed bag. But it all depends, I think, on how it's presented. I do have a client that this ideal client that we go after, and those are people who want to help themselves. But it's also when you get that person in who's a friend of a friend of a friend who's sitting there walking outside my clinic smoking, and I'm like, you know that's not helping your back pain, right? On top of it, he has Parkinson's. I'm like, okay, we're not even healing properly here. It's like, well, I cut down the pack a day. It's like, okay, well, you got 2 packs. Where's the half pack? It's like, I don't know. Well, you already did half of it. Do half of it again. Oh, I guess you're right. And every time he comes in, chip away. You just have to plant the seed a lot of times. And if you don't ask the question, the door's not opened. Does that?
I appreciate your comments. It is a challenge.
Yeah, and it's going to continue to be.
Rural areas where access remains
Right.
a big problem.
I
don't have access to the silver centers. I don't have access to.
Right.
It is
So, well, in your rural area, I mean, so are you in a hospital base or?
no.
Okay, outpatient. So I mean, it's just like what other avenues can you have? Can you bring in a massage therapist? Can you bring in someone who can do some of these things that at least you can discharge and say, okay, well now you have to continue on this. Oh, I don't have the money. Well, they're willing to do a group session on balance activities that you might even train the personal trainer to do. And hey, they're getting money. You're helping your patients. You might even be bringing revenue into the clinic as well.
And it's not necessarily. I don't mean to take up your time.
No, this is.
This is an interesting discussion. It's not necessarily just the patients that are the barrier. It's the system.
Right.
That's the barrier. The system that employs me in this outpatient setting says we can't offer that kind of class. We're not taking cash.
Mm-hmm.
So it's not just the patient that's the
Right.
barrier.
Right, and that's the sickness model of things. It's the sick care model. And just a little bit more about that. But I mean, I've been in the management part of things. If you can come to me and present to me, this is good for everyone, and hey, we can actually make some money on this, or hey, let's donate this money to a good cause. There's so many ways that if you go to if you're not the director, if you're not someone, if you go to them and present it the right way, if they don't listen, you can at least present it to someone else. And I think that's probably why I'm here, is just it has to be a change in the system. And the more that is talked about, the more that is implemented, the more that is shown to be having the results and the long-lasting results. Oh my goodness, these are studies that are done 10 years ago that people still aren't doing these things. And I mean, I can't say anything. I grew up eating junk food as well, but then you realize, okay, well, if I can stop, just like if I can stop smoking, I can reverse that process. And a lot of times it's the education. You have the time with the people, just chip away at their barriers. Sorry, Trish.
I was just going to say, like, based on what Jane was saying about availability and access,
Mm-hmm.
you said community centers, so a lot of times there are community centers. I know we're in a rural area, but in our city there's several community centers that offer variety classes for free. So,
Mm-hmm.
I think it's a matter of knowing those options. And the other thing translates to me into this is an opportunity to help create these opportunities.
Right.
So one thing we have our students now doing is a chair class in a church in a low socioeconomic part of town to make it available to the folks in that neighborhood.
Right.
Some activity. So I mean, you're asking us to shift our mindset in a variety of ways. I think it's the other way. It's not there. How can I create it?
Right. Well, and then goes the fact, well, do I have the time to do that? Well, you have your students being able to do it, but once it's set up, hopefully you can then create this just ongoing effect. Okay, I trained someone to do it. This is just an exercise class. I can train someone else to do this for me. I don't have to be the professional doing that. I implemented it. I made it safe. There's these rules and guidelines around it. Yeah, and be able to go from there. Okay. All right. So let's see. So shouldn't we even want to treat the whole person as best we can just to be able to get the best outcomes is where we need to go. So as PTs, we always want to be measured. You know, we always have these outcome measures. You have to show measurable success to be able to do things. How does this happen with this wellness or this well care model? So one thing we found was what's called the HR QOL, or QOL, or quality of life. So it was implemented by the CDC. It's available online, but it measures, it's basically an outcome measure, and has been verified and qualified and all those. But it measures your healthy days, which inquires about physical and mental health. Then it's also measuring your activity limitations, which inquires about how physical, mental, and emotional health impact your participation in daily life. And then it says healthy day as far as inquires your impact of daily life on how pain, emotional state, and level of energy and sleep affect you. So it's a very long outcome measure, but it can be found online. I'm going to go over a couple that actually Dr. Amanda Ling had come up with that we use in our practice. So these are very simple. Anyone can really kind of make one for themselves, but it's not necessarily has to go through all the rigors. You know, it's dependent, and it's rater reliable. You also are able to give it to the person pre, post, and during their treatment to be able to do this. But this is just a Likert type scale developed by her. It's given to the clients that she's been working with in order to show overall changes for well-being and nutrition, and as well as emotion or mental status. So it's basically the client's view. So it's a subjective wellness assessment, and it's how they're handling those modifiable lifestyle factors. All right, and this is our holistic wellness checklist. This can be implemented into like a past medical history, but this is just a screening tool that was also developed by Amanda to give our patients and clients. It goes over lifestyle, it goes over movement, nutritional habits, as well as medication, supplementation. So it basically gives you a starting point. And so that you can then discuss during your education that you have them in your plan of care or physical therapy. Again, it just kind of opens that door, all right? All right, so the second way of implementing into your practice is this post-discharge programming. This is so options for clients to participate in after. This is what we were talking about before. To participate in after and complement their plan of care. So this gives them the sense of community. It keeps them in your bubble. You've created a habit. They're coming to you 2-3 times a week. You created this wellness habit anyway. Keep them in the family. All right. Let them feel loved. That's what everyone wants. They want this sense of belonging. So this includes personal training, nutrition, sports training, ongoing massage, etc. So we need to think about this, like I talked about before, as our home exercise program is a true prescription to the patients. Not only do you need to do these 3 or 4 things to maintain your mobility and your core strength, but you also are going to go to this and follow up with this. I haven't done it yet, but I need to get a prescription pad. And you write it out, you sign it, and say, this is your prescription. I mean, who's gone to the pharmacy and the pharmacist gives them the prescription and they're like, nah, I think I'm just going to take one of these. I'm not going to take 2 a day like the doctor said. We're prescribing exercise. We're prescribing lifestyle changes. So again, this kind of goes to if they don't have money, if they don't, if that's their barrier. I've actually found even in that it's really not the money issue. It's the underlying issue. So it's that they don't believe yet. All right. So money is really not the issue. It might be a cash flow issue. So but sometimes it's like, no, I can't pay for that $100 class. Well, you're actually paying $10 a month for the rest, for this year, and you can actually go as many times as you want. Oh, well, that makes a lot more sense. I had someone come in who had been somewhere else, and they couldn't pay the cash, their cash fee, and it was the exact same with me. We broke it up. We were able to do something else, and she's like, "Did I just agree to pay the same thing?" Yeah, you did, but you actually listened to them, and you actually allowed them to say, "Okay, that's what works for me." But you have to actually listen and go past that barrier. So what is actually stopping them? Is it truly the money? or is it not leaving with the bag of stuff? You know, it's like, oh, well, go do this. Well, I can't pay for that class. Well, they're not leaving your place with a bag of exercises and saying, hey, I bought something. Like when they go to Walmart and they're like, hey, I bought a TV. You know, I got something tangible. We have to give them something tangible. So be it education, be it something coming back into the clinic so that they actually know what they're getting. All right, so so again, we just need to start thinking about this as more of a prescriptive process for our people. And we also just need to expand the offerings to attract clients too. So people are wondering, well, how is this actually going to happen? So offer classes or programs to the community with the goal of bringing new clients through the door. So if someone's like, well, we can't offer these programs, do it on the front end to bring them into the door, and then be like, well, I'm doing a screening for them, and they actually do have some medically necessary things, and then they're getting patients on the back end. So it's all on the value added proposition. This could also include monthly informational workshops, classes, fitness, coaching, performance training as well. So these are just lower barriers. You have to help get someone into your clinic and in your environment. So most people don't want PT. No matter how much we hope they do, no one's buying physical therapy. They're buying an outcome, all right? So people don't care what you know until you know that you actually care for them, all right? So here is a way that you can educate and give them things that they want so that then you can sell them on what they actually need. They actually need these lifestyle changes. Were you about to say something? Okay. So when you can sell them on what they need, and then this is being in our integrative healthcare model. So heck, I mean, I even stopped telling people what I actually do. So you come up with your elevator pitch. What do you actually do? Well, I empower people to transform their lives. I help people stay active, be independent, without having to use medications, injections, or surgery. Oh, wow, I want some of that. What do you do? Well, I'm actually a physical therapist. I'm doing it through physical therapy. They're like, oh, you can do all that through physical therapy? People don't know, okay? They don't want physical therapy. They want the outcome that we can actually provide. So once people are in the store, they're much more likely to do something. Can you buy something outside a store? Once you step your foot in the door, the longer you stay there, the more likely you're to buy something. So get them in the clinic. So some things that we do that we've implemented, we do a back, we do a neck, and a knee workshop. We also have things called Restore Your Core and Pelvic Floor that we're implementing, and then just ergonomics for new, existing, and new grandmothers. So just things to help our community out. And those are the things to just attract them in. So that's the third way to be able to implement this stuff. All right, any questions so far? Comments? So actually, how can this be done? So I'm going to go over a couple case studies, and then please stop me if you have any questions as we go on through the case study. But I'm going to give you two scenarios. I have someone who went from PT into wellness, and then also went from wellness into PT. So Catherine, Catherine was a 70-year-old female. She had a history of osteoarthritis. She's had seen physical therapy in the past, had seen her physician, had done all these things, had lost weight, all this stuff, and she was just back where she was. So she came to me with back pain. Past medical history of genu-valgum. I mean, literally she walked across the clinic and my other therapist like, is her knee gonna break because it was going in so far? That wasn't her problem. Her problem is her back. Again, don't give them something they don't want. She wanted to get rid of her back pain. So that's what we started with. So during the last few weeks of the physical therapy, where we had treated her lower back pain, she added wellness coaching with the goal of wanting to lose weight, improve her health, having more energy. So we had already gotten to some of her why. Her internal driver, she didn't want to feel so old. Sometimes you don't get that. You're like, I just want to get rid of my back pain, but I just don't want to feel old. I don't know how many women come to me like, I don't want to look like my mom. I don't want to look like my grandmother. So you get to that internal driver. She also wanted to fit in her clothes from last year. She wanted to get back to working with a personal trainer before she hurt her back, and she wanted to, and she gained weight. She gained weight back that she had previously lost. The big thing that I saw with her was she wanted to be able to travel to Texas to be able to be with her grandchildren and just to be able to keep up with their fast-paced schedule. So this is the wellness side of things now. After we had gotten rid of back pain, she then transitioned. So upon review of her current symptoms, she still had joint stiffness, difficulty sleeping, low energy, frequent cravings for sweets, irritable bowel syndrome, and weight gain. So all this was done through those assessments that I was telling you before. Her body was in a high state of chronic inflammation. Review of her medications indicated she only took one prescription, and that was for high blood pressure, but she was taking otherwise just taking over-the-counter supplements. So she was encouraged to continue taking her turmeric, vitamin D, probiotics, and omega-3s because this obviously helps with inflammation. But unfortunately, she had signs and symptoms of a leaky gut, and this was not allowing those to be able to be absorbed. So she wanted to avoid having to take pain medication. So being able to heal her gut through her diet, which I'm going to get into a little bit, was able to have the effect with these over-the-counter supplements to help decrease those inflammatory responses. So she kept a detailed 3-day food diary, which indicated that she was having a high carbohydrate protein bar for breakfast and for lunch because she thought, hey, I'm eating less, I'm going to lose weight. This is what she had done before. It was one of those places you go and they give you your food and take these things and you're going to lose weight. But then she was snacking throughout the afternoon on breads and cookies and sweets, and again in the evening after dinner. But she was making a well-balanced meal for dinner for her husband with meat, veggies, and a complex carbohydrate. But she was just not knowing what was going on. So the wellness coaching suggestions that she went through included first cutting out the processed foods, including the bars and eliminating the highly inflammatory oils and foods, then replacing the afternoon snacks with nuts or maybe even a healthier treat, educating in portion control, especially for the starch in the evening meal. And then obviously increasing water intake. I don't know how many times, oh, well, I got a cramp. Well, how much water do you drink? You're supposed to drink water during the day? What? And so we gradually increased her to 100 ounces a day. She was at 200 pounds. And we encouraged her to incorporate more healthy fats, cut out the evening snack, and shorten her eating window. So that was just to allow her gut to heal. Now, some of you might be saying, well, I don't know all that. Well, this is all information that you can learn. This is health information that you can collate and be able to disseminate to your clients. So we also gave recipes, suggestions for healthier food swaps, incorporated bone broth recipes into her diet several days a week, which bone broth has a natural healing process to the gut as well. And in all of that, she reported great improvement in her energy. She came in one day, she's like, I cleaned my house. And I was like, uh-oh. She's like, but I cleaned my house and it didn't hurt. As well as she had decreased pain and stiffness. So we had treated her back. She's like, oh, my knee always hurts. But she was realizing, hey, that actually feels better too. So she even said she woke up every morning for years, stiff and sore, and didn't realize that you could actually get out of bed and walk to the bathroom without pain. And you hear that and you're like, this is why the heck I'm doing this. All right? So she also reported improved sleeping throughout the night, and after incorporating a short meditation before sleeping, she was able to fall asleep more quickly and get into her deep REM sleep better. So she reported general overall improvement, quality of life, and then she also added daily walking program in addition to strength training that she did with the personal trainer at our clinic, because she said, I'd rather be here with y'all where you can oversee everything as well. And she was performing that on a 2-day-a-week program as well. So that was going from PT into wellness. The next guy, or the next client, his name's Dwayne. He's 30-year-old with a history of obesity and a recent diagnosis of diabetes. Now, how he came to us was actually from a client, or a PT client, who was working on her back pain. Obviously, back pain's an epidemic. She was feeling a lot better, but she wanted to do some wellness, and she said, hey, I want my husband to do it with me. So he was supporting her in this. So he was taking medication for high blood pressure, low testosterone, and metformin for blood sugar regulation. He worked out about 6 days a week at a gym for 1 to 2 hours, performing cardio, strength training, and there was no change. He wasn't getting anywhere. He was still 230 pounds, and he was about 5'6", and he was doing all this stuff, and he just didn't know why, and he had just been diagnosed with diabetes. So his goals were to lose weight, improve strength at the gym, improve his blood sugar, and he also reported poor sleep, high stress job, low energy, and his endocrinologist that diagnosed him with diabetes told him that the only possible way to decrease his problem is to decrease his carbohydrates to 30 grams per day, but that was all he said. That's what the doctor, the endocrinologist, just decrease your carbohydrates to 30 grams per day. So obviously he was frustrated. He just didn't know what was going on. So this is where we can have that guidance. So he didn't know how to actually incorporate these healthier lifestyles into his, or practice these healthier lifestyles. So his wife, who again was for back pain, was also obese, and they were able to do this together. So with the wellness coaching, we were able to provide education in macronutrients, what they actually were, because he didn't know what those were either, and the role of insulin in the pancreas and the body, stress management, sleep hygiene, inflammatory foods, promoting metabolic disease, and more, just the education part of things. So after discussing the doctor's recommendations for various dietary strategies, he chose to pursue a ketogenic diet, which is basically the 30 grams of carbs or less a day anyway. So he decided to pursue that and was coached on how to make the transition with his diet that he's doing now. His food diary actually indicated that he was consuming upward of 200 grams of carbohydrates in his breakfast alone, and he didn't know it. So he was doing this healthy fruit and veggie smoothie, and he didn't realize, oh, the sweet potato I'm putting in my smoothie is carbohydrates. So he was actually taking in 200 grams of carbohydrates just in the morning, and he'd just been diagnosed with diabetes. So we really don't know what we don't know, okay? So subsequent meals included eating out a lot, processed foods. He had obviously the high stress job, candy bars when he's stressed at work, and protein shakes surrounding his workouts. Why? Because we're supposed to drink protein before our workouts, right? So again, trying to collate this information for each other. So through food testing, this was in conjunction with a functional medicine doctor in the area. So through food testing, we identified digestive problems and inflammatory response to gluten, dairy, and nuts. So recipes, food swaps were suggested. He chose to decrease his eating window to 6 hours a day to help heal himself for a time, but then we found that he wasn't eating enough calories to be able to fuel his workout, so that window was just increased to 10 to 12 hours. So he demonstrated a steady progress, and at the end of 18 weeks, so I mean, you're thinking people are trying to lose weight for a long time, just 18 weeks he lost 50 pounds, he improved his max lifts at his gym, he had more energy, he was able to run a 5K and do a Tough Mudder. His wife had lost 35 pounds, had started been able to do the yard work that she would love to do, and also was walking and running with him. So he was encouraged to go back to the doctor and have his A1C tested because he didn't want to do his finger sticks himself, and it was found that he had normal limits. And he was taken off his metformin and told he no longer had diabetes. So the stuff really works when it comes down to it. So at the end of his wellness coaching sessions, it was identified that he had some joint pain from his increased activity level now that he was doing, and he was pushing himself at the gym, so he was evaluated and treated with physical therapy in our clinic for both knee and shoulder pain, and had successful completion of his plan of care. However, he was still having some issues and wanting to increase his performance. So because of that, we actually put him on what's called performance package. And since it was no longer medically necessary, this was a cash-based service for us to increase his mobility as he increased his exercises. And follow-up indicates that he was maintaining his weight loss and steady blood sugar readings, and he just did his second Tough Mudder 3 weeks ago. All right, so I don't know if I rushed through that at all, but do we have any questions? My thank you is, Trish, thank you for pushing me to do this, and to my wife, Amanda Ling, Mike Eisenhart, and obviously to y'all for coming and sitting through my diatribe. All right, any questions? Yes?
You mentioned the CDC had a wellness
Yeah, the wellness guideline.
something you can find online there at the CDC?
The HR qual, yeah, if you just search, it's HR like heart rate, QOL. Yeah, quality of life survey. It's a really long and drawn out survey, but at least it'll give you something to start off with. Like I said, you can come up with those assessments. Yeah, I mean, make it simple, make it easy for the patient, do it pre, during, and post, show your progress, and you know, it's valid for that person. I mean, it's kind of like, oh, how many people come in and say, oh, I have a high pain threshold? Like, compared to what? It's compared to you. It's interperson rated there, so you just take it with a grain of salt. Yes, Trish.
From the time you started, the concept of this and opened your doors, how long did it take to build the practice in the direction that you got it going?
We always knew that we wanted to bring in other disciplines. I'm still searching for the ones that I want. I have the room for it. We have the personal trainer now. But I mean, I found a personal trainer probably in the first 6 months who wanted to come in and be in part of more of a medical model. They brought in their own clients as well as we were able to feed them our clients, and they were able to build up their own business. So there's always that symbiotic relationship that you could find with personal training, massage therapy, any others that you can like that. So it took a few months to find the right person that fit into your culture, because obviously you don't want any. We've gone through a couple personal trainers, but once you find one that actually is on board with you, it's a very symbiotic relationship.
And what about the patients? Was that challenging to get people to participate? I mean, or
Into personal training,
well,
or into just
to expanding what they're getting out of it.
right. And really, it was just asking the question. So it's like, what do they want? So how many times do they ask, you know, well, what are you doing? You look fit. Well, I work out 5-6 days a week. I'm like, oh, okay. Well, that doesn't really help them. Well, it's like, well, they want to lose weight. Well, do you want some help with that? Just ask the question. So that's what I was saying when they say, yeah, I know I need to lose weight. What are you doing about that? Nothing. Well, would you like some help with that? And if they say yes, then it opens the door. It actually kind of was like, oh, well, I better figure out how to do this. This person wants it, and I want to be able to provide that to them, because I'd rather them not go to the strip mall across the street and get stuck with the processed food that they're going to get.
And once you change how you were framing your relationship and your episode of care with the patient, they bought into it.
Right. It's really the communication. So again, if they know that you care about them, then they're willing to listen to what you have to say. So if you're able to actually have that honest conversation with them, is this truly what you want to get to? And if you can confront them on the barriers that they're showing, be it cash, be it time, be it anything like that, is then you can actually say, okay, well, how am I going to tailor this for them? So that's what I was saying before. It can be some tailored programs. Well, maybe you meet with our wellness coach for 3 visits and then go into our personal training. Oh, I can't. There was someone who was like, well, I know you're out of network with my insurance. Okay, well, this is what I can do, and then I can pass you on to our personal trainer. Now, I don't want you to think that that's going to get you exactly where you want, but until you kind of see that, they're not going to go forward with your plan. So if you can help them out a little bit and then give them what they want, is then they'll ask you when they need something.
Another question. So in terms of resources, you said you informed yourself. It sounds like you felt really well prepared as a PT to do this, but you added to your.
Right. I mean, it's a small amount of nutrition that you learn in PT school. It's actually more. Amanda has done continuing education, nutrition certification, that sort of thing. But a lot of times, if you want to learn it, I'm part of MedBridge. There's at least 6 courses as far as integrative health that you could take. I think actually is on here. Yeah, Russell Serto has several courses on there about it. But it's just a matter of you feeling comfortable with being able to offer this to people. And again, I'm the first one to say it's not perfect with what I'm doing, but it's better than what is out there, and I'm changing it as I go along. Just iterate and offer the things for your clients. Yeah.
Can you describe to me what your physical structure of your clinic looks like? Is it a typical PT clinic, or
We started off like that. If you're talking about just like layout, it's probably about a room like this. I got my beds, and then we have kind of a workout area as well with a functional trainer. We have our weights and our kettlebells that we use as well. Because, I mean, if we're doing any manual therapy, you got to load them afterwards. So there's always that therapeutic activity or that TheraX afterwards. So yes, I am a manual therapy by trade, but then you have to add in the physical aspect and the loading aspect on top of that. So that's kind of where we're almost kind of split. We have our treatment tables on one side, our functional training and exercises on the other side. We have a private treatment room for more delicate conversations to be had, or if you are needing to have the come to Jesus talk with someone.
So your personal trainer is in that same structure?
And that's the other, yeah, she's in the structure. She comes in, she has her own clients as well. We pass on our clients to her. She's like, yeah, I'll do a sit down with them as well, just to see if they're the right fit. And then I don't know how many people I'm working on. They're like, what are they doing over there? Well, that's actually our personal trainer. Like, oh, wow, I didn't know y'all had that here. So sometimes it's top of mind. Like, hey, is that something that you actually want to move towards? Again, you've opened the door by asking the question. But if it's not there, or if you don't ask the question, you don't know what they really want.
That's a really good idea. But she's not functioning as a PT tech for you at all?
No, she's the personal trainer. Yeah, we do utilize a tech right now, but that's for carryover effect of some of just the therapeutic exercise that we're doing.
Are y'all doing mental health screening and referral as well?
We do. We have about two psychologists and one social worker that we work with. And when it comes to those, I had someone today give me a 30-minute conversation about being abused, and I'm like, okay, have you talked to anyone about this? And you just, again, you open that up and you have those people to refer out to. Any other questions? Well, thank you. I appreciate it.